I always tell my patients, look, when we are fighting with the cancer which you have, the disease which you have, then it requires approach and understanding and support from many different fraternities. Just a nuclear medicine, radiopharmaceutical therapy alone is not sufficient. We really need to know which options do you have so that we can attack that cancer cells more effectively and at the same time maintain your quality of life. And for that purpose, we need to discuss the disease which you have, the treatment options which you have, how the follow-up will be done, which lab values we will be taking. All those things need to be discussed in a multidisciplinary setting. And that's where we work very closely with our radiation oncologists, with our medical oncologists, even the pathologists and the nutrition psychologists, so that we can give you the best option. The most meaningful aspect of caring for a patient is the satisfaction which you get when a patient is able to overcome the disease and live a life in a good quality and kind of has a normal life. That's the biggest satisfaction one can get by treating a patient, specifically a cancer patient, because they are fighting very hard against this disease in their body. And if you can make a difference and make the quality of life also very good, that's where the satisfaction sets in. It's beautiful. My specialty is in radiopharmaceutical therapies. So the biggest concern which a patient has when patient walks in is, what is a radiopharmaceutical therapy? A radiopharmaceutical therapy is a next generation therapy. It allows a very personalized treatment of your cancer cells by preventing and allowing you to have a very good quality of life. So you should be trying this out. Having an option like this is like having an opportunity to live longer. Because it is a relatively new field, they want to know what has been done until now, how the future will look like, based upon which studies we are offering them this approved treatment options. So the Siteman Cancer Center has got everything which a patient can actually be asking for. The way the patients are cared for, and they are taken hand in hand, and whenever there is any problem, any query, which starting from some nutritional support or some social support, some psychological support. Treating a patient is not only looking at the disease, but when a patient comes in, that patient comes in to us as a human being. And that's what we may want them to feel when they're at the center where they get treatment. And Siteman Cancer Center, with all its infrastructure, gives them this opportunity. Feel being human while being treated. A good day for me is when I see patients walking in to get either some diagnostic, some consultation, and some treatment. And when they go back and we have given them some good news, that's the best day for me as a clinician. Overall, the patient satisfaction when the patient goes back home is what, for me, defines whether that day is so good or bad.